My name is Patrick, and I work as a veterinary technician slash surgical assistant. Typical day, I come in, check any patients that have stayed overnight, any sick patients, check their charts to make sure what they need as far as medication, administer the medication, and check vital signs to make sure the pet is doing well or better than what it was. Mark everything in the chart, and then prepare for the rest of the day's duties as far as any setting up for the doctor for examinations, pulling vaccines, doing any tests that need to be run, make sure you lay out everything for the doctor, assist the veterinarian in the examination of the pet. As far as what my job entails is holding the pet, holding off the vein, make sure that the doctor doesn't get scratched or bit, and restraining the animal basically. And then running any tests that need to be run and administering vaccinations. The daily hours basically from whenever you're scheduled to come in until all the jobs are done. You may have to stay late if emergencies come in. So your daily schedule varies from one to another, but mostly it's a 8 to 10 hour day. Stress level can be a little high depending on what pet comes in with what problem. Any trauma pets are always a little higher in stress because the balance of life and death is there, and you have to work accordingly. The surgical part, any patient that comes in for surgery, whether it's general anesthesia, simple spays and neuters, or an orthopedic patient that needs a leg mended or a knee fixed, you need to know the names of the instruments, what instruments need to be used for that particular procedure. Lay those out in a sterile fashion, make sure everything's has been autoclaved and sterilized for the use, so you cut down on any infection. And then assist the veterinarian during the surgery with retraction and sponging and also the anesthesia, monitoring the anesthesia to make sure the pet isn't too deep or not down enough. Make sure the balance is there for the anesthetized patient. Then also monitoring the patient during recovery. That's real important. Make sure that he comes out of the anesthesia in a comfortable fashion. That he's not thrashing around and is not in pain, and make sure all his medications are administered afterwards. In order to be a vet tech, a high school education is pretty much required. Depending on your job title is really what your education requirements need. If you're going to work in the kennel, high school education is fine. If you're going to continue on to become a vet tech, then some college courses are needed. There are some local colleges and universities that offer a vet tech program, which is highly advisable. You'll end up knowing so much more, and you will use that knowledge eventually. And as far as your education is never really complete, you will always take some continuing education program or seminar will come locally that you will need to attend to keep you abreast on the new techniques and new procedures for the patients. To become a surgical assistant, I personally had to take some online courses. It's also education in nursing and bandaging and IV fluids, and all that is covered. Splinting, splinting broken legs and plating and all the need-to-know information that you'll eventually come across in the practice that is useful and necessary, and any education that you can get is always advisable. The best part of the job definitely is the new pets, the new puppies and kittens, and making sure they're healthy when they come in, and making sure that it's a pleasant experience for the owner as well as the pet, that we are not the enemy. You know, we are the good guys, and we're there for a particular reason, and that's the pet's health. And that's by far the best part of the job, and seeing a patient that you've treated and nursed back to health, and watching them leave the clinic with the owner's smile on the face, and that kind of, you know, that's always very reassuring and fulfilling. Worst parts of the job, you know, you're going to run across a fractious animal, one that doesn't want to be there, ones that's scared, fear biters, feral cats. You will get scratched, you will get bit. I got scars to prove it. But that's part of the job, and you try your best to minimize that aspect. You know, nobody wants to get bit, nobody wants to get scratched, but it's going to happen. You just have to take all the precautions to minimize that. Then getting to the end of the pet's life, the end of the life cycle is always, or it can be, a difficult one in a couple of ways. You've treated this patient from the time it was a puppy or a kitten to now it's 13, 14, 15 years old and in failing health, and the option is either more tests or to do the humane thing and stop the pet suffering and put him to sleep or euthanize it. That can be very difficult to deal with emotionally. Sometimes the owner wants to be with the pet when it's euthanized, and that can be an emotional time for everybody. No one wants to lose a friend, but we have the ability in our practice to humanely stop the suffering of a pet that's in trouble. And in the big picture, you can feel comfortable about that, knowing that you did the right thing for the pet. And it's not always easy, but finding a place to put that emotion can be trying too, but it's all part of the job that you need to be aware of. If you're thinking about getting into this field, I would definitely advise to at least volunteer with your local veterinarian. They will probably set you up as in what position they needed filled, but volunteering in a kennel, cleaning up after the animals, making sure they're fed and watered is a good start. And if the veterinarian will let you watch a surgery, that's advisable, and know what you're getting into beforehand. If you're allergic to cats, this may not be a good field to get into. If you're scared of large dogs, that you may need to address that if you're thinking about coming into the vet business. Any education that you can get is advisable, because you're always learning something new, and a lot of math, a lot of biology, a lot of anatomy, chemistry, all that is, you will use it on a daily basis. So any education that you can get is advisable.